Hey there, I'm here with Lloyd today. He is post-op or after having a surgery, and I wanted to chat about the important management principles when you go home with your pet after a surgery. So, number one, they will have a cone, and it's so important to have something to prevent them, he's very excited about the food, to prevent them from being able to lick or scratch at their incision. Because after all of that anesthesia, the surgery, everything, you want to make sure that heals as best as possible. If they lick or scratch, it can lead to infection. It can prevent, of course, healing from going appropriately. It may even open up and they may need another procedure. You can sometimes take that cone off when you're directly with them. So if you're feeding them, if you are playing with them, you just want to make sure that they cannot and do not lick. And especially if you're stepping out of the room for a moment, when you're going to sleep, anytime your eyes aren't directly on them, you should really have that cone on. Lloyd here is rocking a soft e-collar. Some animals do need a hard e-collar. It just depends on what type of incision and how your pet is. They also make these inflatable, like inner tube ones. They make, or you can design your own t-shirt to cover the area if they're scratching with their hind legs or getting creative, trying to get at that incision. So, other things. After surgery, after anesthesia, your pet may not poop for a few days. Why? So that's something that I get a lot of calls about. People are really worried. Their dog just had belly surgery and now they're not pooping. As long as they are eating, acting fine otherwise, not suddenly incredibly lethargic or worried. Hey Lloyd, come over here. Come to your bed. Go to your bed. Good boy now. He's not facing you. Here, baby. Yeah, good job. So, as I said, as long as they're still eating, peeing, that kind of thing, anesthesia can slow down. It does slow down GI motility. So, even though they're eating, they're not pooping as much because everything's just a little slower. It's going to come out. They may have a little diarrhea as well. Those are all very normal things. If you see them straining to poop, or they did have a surgery on their colon or near their actual rectum, maybe a different story. Definitely reach out to your veterinarian in case it's a problem. Lloyd, come sit down, baby. Good boy. Down. Good. So, your animal, as Lloyd is demonstrating great for us, is probably going to be pretty disappointed because another really important thing with management is you want to stop allowing them to play with other dogs and really reduce their activity level so that they can recover. This is really important, especially if they have a large belly incision, because any stretching, jumping, a lot of movement can cause too much strain on that and it just be uncomfortable for them. It's just like in humans, if you have a big belly surgery or procedure, you're told to be on bed rest and really not do much. Dogs don't know how to do that for themselves, so you really gotta help them out. And good boy, Lloyd. Sometimes that does mean, especially if they had an orthopedic surgery, like a knee surgery, they may need to be in a crate when you're not with them, prevent them from running around, jumping up and down stairs, things that'll add unneeded stress to that area. Hi, good job, good job. Typically, after a surgery, your surgeon or your veterinarian is going to ask to see them back again. Anywhere about 2-week range, 10 to 14 days is pretty typical. Reasons for that: number one, they may need to remove sutures. They may also just want to examine the wound if there are no sutures that need to be taken out. But it's really important to make sure you do follow up because sometimes it's hard to tell on the outside if there is a problem going on in the inside. Things that can happen. The incision can start oozing. Ooze that's a little bit of just clear material or even a little bit of blood can be normal. You'll probably be instructed to put a compress, like a cold compress, getting ice out of the fridge, putting a thin cloth between the ice and your dog's skin, or warm compresses, just making sure they're not too hot to hold against your own skin before applying them to any area. These both can help reduce inflammation. And similarly, you may be sent home with pain medications, and those should be with food. So a lot of those can have belly upset or issues if if you don't feed them with food. So basically, the main parts of post-op care for your pet are cone, making sure they can't get to their incision, rest, whether that means in a crate or just leash walking them, not allowing them to jump and play with other dogs, and just generally monitoring, watching the incision, making sure they're eating. It's okay if they don't poop for a few days. And of course, lastly, follow-up. Go back to your vet, make sure everything looks good. You can always call them and just take pictures. I love having clients or owners send me photos of the wound if they're not sure something's wrong. We'd rather check it out early. So, hope that Lloyd has a speedy recovery. He certainly wants to go play with his pup friends, but luckily, having lots of enrichment with food, with new toys, he's doing pretty darn well. See you later.